A very good morning to you. This is the Synthesis Podcast. I'm Howard Feldman. It is not Sunday. It is Thursday, the 24th of September, and it is Heritage Day. One of the things that I learned as a commodity trader, which I was for about 15 years, is that we are not nearly as smart as we think we are. When prices go up, we behave as though they will never come down. When prices are low, we think that they're never going to return to former levels. I also know that when we pack a suitcase in hot weather, if we anticipate traveling to cold weather, we know intellectually it's going to be cold, but somehow we just can't feel it. We always leave something out because imagining it is very different to feeling it. Is this the same as the situation with regard to a second surge? Joining me today, as he has done for many, many months, is Dr. Anton Meyberg. He doesn't like to be called a COVID expert because he says there's no such thing, but he has been in the trenches for the last number of months at the forefront of fighting the pandemic at our hospitals, as well as giving advice to various organizations around the country. Dr. Anton Meyberg, good morning. How is it looking for us today, Heritage Day, the 24th of September?
So good morning and happy Heritage Day to everybody. I hope you're all getting your bras ready and your beers ready and ready for a great Heritage Day. There are currently 32,110,901 cases worldwide, with 982,196 deaths and 23 million cases resolved. The United States is sitting on 7.13 million cases with 206,000 deaths. And South Africa has 665,188 cases with 16,206 deaths and has now moved down to 9th position in the world odometer. Currently, we're sitting on about an 89% recovery rate. There are currently 1,863 cases of COVID-19 in Gauteng hospitals, with 216 ICU and 85 ventilated. Over the last 3 days, the numbers, however, have steadily increased from 725 to 1,346 to 1,906 yesterday. And it's been over 200 days since the first COVID-19 case was confirmed in South Africa. We're now at a time when there's a perceived lull. Cases are generally below 2,500 cases a day, and the hospitals are much quieter. But we need to remember the most important thing. There's an extremely high chance of a second surge. If we are complacent and we don't follow the rules, if we don't respect COVID-19, it will lead us down a dark passage and will take us into another desperate time of illness, of worry. We need to be aware, we need to be careful, we need to protect each other, and we desperately need to prevent further lockdowns.
Let's just take a look at what's happening around the world, because one of the advantages that South Africa has had is that because we're in the Southern Hemisphere, we're a few months or a few weeks behind what we're seeing in the Northern Hemisphere. Taking a look at what is happening there, your thoughts?
Pure devastation, pure panic, pure terror. I mean, in places overseas, we're seeing what we're calling a second wave, not a second surge. Now, if we look at a second surge, we're at a very high risk of having a second surge because we haven't completely cleared the virus. So we've still got active virus, over 2,000 cases a day. Whereas overseas, in many countries, they'd reopened their countries, they'd reopened their borders, and in a way, they'd said they'd completely cured the virus. They've now developed the second wave of virus, which is completely devastating the countries. In the countries like Israel, where they're up to over 9,000 cases a day, multiple deaths. The United States, where we're seeing over 7 million cases, where there's no continuity between each state. Each state runs as its own country. No one's working together in harmony. In Spain, in France, all over the world, we're seeing the second surge and these second waves happening. And it's quite terrifying to see what's going on. However, although there's a large number of cases, we're not sure how devastating the case will be compared to the so-called first wave.
So what does that mean? Does that mean that we are seeing more cases but with less severity?
So even if we look now in South Africa, speaking to a lot of the GPs, they're seeing a lot more cases now over the last week compared to 2 or 3 weeks ago. But at this point, all these cases are being managed at home. So we don't know what the severity of the second wave or second surge is going to bring, but it's still a big worry.
Right. One of our viewers, Brian, has mentioned the word long COVID. What is that?
So this is a multi-system disease. It generally extends beyond 3 weeks from the first onset of symptoms, whereas a chronic COVID is extending beyond 12 weeks. And a lot of patients, at least about 10% of patients who are tested positive for COVID, remain unwell after a 3-week period with fatigue, with shortness of breath, with headaches, still with loss of smell and loss of taste. And the reasons for this prolonged recovery is a persistent viremia, it's persistent virus due to weak or absent antibodies in the system, a relapse or a reinfection, which is less likely, as well as inflammatory and immune reactions. One of the other big things of this long COVID is post-traumatic stress. So we've got to be aware of it. We've got to watch out for it. And I think we've got to go back to basics and remember that the COVID-19 is a single-stranded RNA virus. The virus spike protein binds to the ACE2 receptor, the angiotensin converting enzyme receptor, which allows it then to enter the cell and cause havoc. And we've got to remember that these are all the things that are still happening.
Mm-hmm. Is this the treatment since the last time we spoke more or less the same?
The treatment is more or less the same. We've got all the treatment modalities available here that they've got overseas with regards to remdesivir, with regards to dexamethasone, with regards to convalescent plasma, with regards to any of the treatments overseas, tocilizumab. We've still got the same treatments and we're still on the same page as all they are overseas. The only thing that's not happening at the moment is the actual issuing of vaccines because they're still only in phase 3 trials.
All right. And for prevention, you still recommend multivitamins, making sure that you have vitamin C, vitamin D, and zinc.
You're a good learner.
Listen, we've done this just often enough. All right. Carla says she's very, very worried that she's starting to see more people running, interacting with no masks, a lot of complacency. Is this something that you are seeing and that you're concerned about?
Sure. It's a massive worry. You know, when you go down to level 1 lockdown, you can't expect people to believe that there's any issues. I think people still got to remember we're still in lockdown. There's a reason that we're in lockdown because we still haven't defeated the virus. The virus is still out there. It's still replicating. This morning when I went for a run, I saw a group of 20 cyclists cycling past me. Not one of them were wearing a mask. Multiple runners aren't wearing a mask. And take it away from the athletes. Take it away from just the people in the streets, people walking around, people going to shops. The numbers have decreased. We know the biggest preventer is people wearing masks and social distancing and hand hygiene. But masks are one of the biggest non-pharmacological preventers of spreading the virus.
You know, that's such a strange thought just occurred to me. I mean, cyclists wear lycra. I mean, if they're prepared to wear lycra, surely in public, surely they'd wear a mask.
Who knows?
All right. Clearly no medical answer. Clearly no medical answer for that one. It was just a random thought that I had. All right. Melanie says a large number of our elderly people live alone, children overseas, etc. They do not seem to understand mask social distancing. What is the solution? A few people asking around that, just on that point as well. A question from Nurit. She says, my grandmother and her friends have been missing their weekly card game due to COVID since level 1. What's your thought on them resuming their games? Do you think it's suitable for them to start again if they wear masks, use a fresh pack of cards each time? And if so, can they do this with COVID protocols? We're seeing loneliness and lack of human connection as a very real factor, and probably pretty dangerous as well to our mental health and therefore physical health.
So unfortunately, our biggest worry of comorbidities is the elder patients. So to take elderly patients and expose them to other people is a big worry. There are other forums. I mean, we ourselves have a poker game which we play on a Zoom interface, you know, but you can play bridge or you can play cards on a computer. You know, I know that it's not the interaction with people, but being an elderly person, your comorbidities are high, your adaptation of how to adapt to a virus and how to treat the virus is very different to a younger, healthier person. And I wouldn't recommend this because you're in close contact with the people. Even if you are wearing masks, you're handing the cards, you're not very vigilant. You can be touching your face, touching your mask, lifting it up, touching the cards, passing it to each other. Rather stay away from it and do it on an online program rather.
All right. So your view at this point is just, it's not great, but and it's not easy, but just hang on a little bit, especially because we're in this lull period.
100%. And we just got to be very careful still, because we are expecting another second surge. And it's up to us to determine how bad that second surge is going to be. The power is in our hands. We can actually control it, but we have to control it properly.
So David says, as we've not found a vaccination for HIV and it's been 30 years, how positive can you be that we're going to find a vaccine for COVID-19 within this year? Plus, the challenge of getting 7 billion people to vaccinate, as well as dealing with anti-vaxxers, etc. It's a good point. It's a mammoth task.
It is a mammoth task, and it's a very good question, David. And unlike the flu vaccine, this vaccine, as we've said before, has been generated within a number of months. I mean, 8 weeks after the virus was established in the medical world, they already sequenced the genome of what the virus was. So we're now in phase 3 trials with 4 different vaccines. In fact, the new Johnson & Johnson vaccine has just entered phase 3 trials as well, which is a single vaccine that they're speaking about. It's quite difficult because the rollout of the virus is going to be the biggest problem. And as we've spoken about that before, the Americans have put billions of dollars towards rolling out the virus. They've already started producing the virus in the hope that these phase 3 trial viruses will be efficacious and will go to phase 4 and they'll be able to be used in people. But there's going to be sort of a regime of how the virus is handed out. And it's going to start at the top, most likely with your healthcare workers, your healthcare personnel, then go down to elderly and your people with comorbidities, and then to other people. The biggest issue we've got is the lower income countries, like our country, South Africa. Will they be high on the list of receiving the vaccine? And we're hoping so. We're hoping together with the World Health Organization and all other aid agencies that we will be given this vaccine. Now, with regards to the vaccine, we don't know if it's going to be very similar to the flu vaccine. In other words, will you need a yearly vaccine? Will it need to be reconstituted according to the seasonal affectation as what it's like in the Northern Hemisphere, what it's like in the Southern Hemisphere? I think time will tell with that as we go along. But at this point in time, we're desperately hinging our bets on this vaccine coming in the next few months, and we've got to just keep our hopes up for this.
Are we starting to see here in South Africa people getting reinfected, or is it still are we still too new within
so
our own?
We haven't got any documented cases of reinfection in South Africa. A lot of the cases we're seeing are people that have not cleared the virus effectively and are still part of the initial virus. So nothing with the NICD that's been proven yet to show us that there's a reinfection in South Africa yet. We have seen, as we said, in Hong Kong and Amsterdam and other countries, but not here as of yet.
Right. And I know that they've been doing a tremendous amount of antibody testing. Very interesting in that some of the people that I've spoken to have what they consider very strong antibodies. Some people who I know have been hospitalized for COVID-19 are not showing antibodies. Can you just take us through a little bit of an explanation around this?
So what's interesting to note is that about 25% of people who are COVID positive will not develop antibodies to the actual virus. So in other words, 25% of people will not have any antibodies and have shown no signs of having had the virus despite having been sick. So we need to see what's going to happen with regards to the antibodies. As I said, the antibodies aren't the be-all and end-all of the answer. We don't know how long the antibodies last. We're thinking that they're lasting about 3 to 4 months. We've still got to assimilate it or try to get this together with the T-cell antibodies, the T-cell memory cells, and see how people's reactions are and what the reaction is to other infections, and can they get reinfected over time from this. So it still is confusing. It is nice to know that if you do have antibodies that you have had the virus, but once again, it doesn't give you immunity because we don't know if you can spread the virus to other people again, or if you're immune suppressed, you can pick up other types of viruses. So you still got to be very careful.
Right. We're coming up for the holiest day of the Jewish calendar, which is Yom Kippur. Special dispensation has been given to the Jewish community to hold services longer than 2 hours, just specifically for this day. Lots of questions around this. Do you feel it's safe? Would you prefer a 2-hour service? Do you think that people who are bald, for example, or who are dangerous minglers, not that I know any of those, but if assuming that I did, should still rather refrain from being there and rather just to take the day at home. What are your thoughts around this?
Look, I think we've got to realize that this COVID virus is a very clever virus, but it's not clever enough to know the difference between 2 hours and 2 hours and 10 minutes. You know, that's a government instituted law, and that's the law we've got to follow because that's the law of the country. We've been given special dispensation to keep the services up to about 4 hours, and it's a once-off thing. And I don't think the COVID will precipitate or preempt that and know that there's a difference. Because what I saw on the Jewish New Year, on Rosh Hashanah, was that the laws were kept extremely strictly. There was social distancing. Everyone wore their masks. Everyone went out different entrances. Everyone stopped mingling with each other, and people just did the right thing. And if we can maintain that and keep those norms for the Yom Kippur, for the fast day, then those 4-hour services are going to be very relevant and we'll be able to do it. The most important thing is that after the services, we can't mingle. Mingling is the issue. We can't socially interact with each other. We've got to keep our masks on. We've got to get home and then come back 2 or 3 hours later for the next service.
And guidelines in terms of people fasting, I know we can't cover them all here, and people do need to ask both their doctors for guidance. In fact, they need to ask their doctors for guidance if they're concerned. But do you have a general thought around it?
So look, you've got to ask your local rabbi what actually your issue is, and you've got to discuss it with your doctor, as you correctly said. There are different ways around it. Obviously, if you are COVID positive, you cannot fast. There's no doubt about that. There's a whole concept of what we call shiurim, which is certain time allocations where you can drink certain amounts of fluid or certain amounts of food that you can eat. But that you've got to discuss with your rabbinical leader together with your doctor and see if that's appropriate for you. But it's not just a blanket, you don't have to fast. You need to discuss it with your doctor and with your rabbinical leader.
Okay, let's just take a look at some of our other questions. That, in fact, and here's a question that apparently we've ignored for weeks, certainly not intentional, but somebody's asking about using HOCl, hypochlorous acid, as a disinfectant, and obviously wanting to know if it's a good disinfectant to use in terms of cleaning surfaces, etc. Your thoughts? Do you have any knowledge on this?
So, the purpose of a disinfectant is to basically, you want to change the protective protein coat of your virus that you're dealing with. You want it to destroy the cell wall of the virus, which allows the disinfectant to inactivate or destroy the virus or the microbe. Hypochloric acid that they're talking about is used as a non-toxic agent. It's non-toxic to surfaces, it's non-corrosive, and it's relatively inexpensive. And some of the dentists use it for the mouthwashes, and it doesn't cause any gastric irritation. It's currently used in the dental and the maxillofacial practices, as well as in ophthalmology practices and in wound care. So seemingly it's very safe and very effective and very cheap, and it is an alternative to cleaning areas and surfaces, and it's probably very good.
All right, brilliant. The other thing I wanted to ask you is about World Lung Day. I think that's coming up. Is it tomorrow?
So tomorrow, 25th of September 2020 is World Lung Day. And it actually takes us one step back from COVID-19 to reality that there are actually other diseases in the world. It's a day for lung health and advocacy and action. It's a call for an action to promote healthy lungs. And being Heritage Day, just like we've got the big five in the parks, we've got the big five in the lung world. And the big five are COPD, asthma, acute lower respiratory tract infections like pneumonia, TB, and lung cancer. And if we look at them in sort of isolation, COPD affects more than 65 million people in the world. It's the third leading cause of death worldwide. It's a chronic inflammatory lung disease that results in progressive and irreversible airflow obstruction, with acute episodes of worsening exacerbation. And the airflow obstruction or exacerbation arises from a combination of a chronic bronchitis and emphysema. If we look at asthma, asthma is the most common chronic disease of childhood, affecting about 14% of our children. It's characterized by airflow limitation and an inability to get air out of your lungs. In most patients, however, it's fully reversible once on appropriate therapy, and it is negligent to not be on therapy in 2020 because it is a treatable disease. The number 3 of the big five is TB, tuberculosis, which is probably the most fatal infectious disease, with about 10.5 million cases in the world and about 1.4 to 1.5 million deaths annually. Number 4 is your acute lower respiratory tract infections like pneumonia, which is one of the top causes of death. And number 5 is lung cancer, which is the most common lethal neoplasm in the world. And then obviously we get the smaller ones like obstructive sleep apnea, pulmonary thromboembolic disease, pulmonary hypertension. And we've got to ask ourselves, why do these lung diseases cause so many issues? Because we've got to remember that the lung is an internal organ which is most vulnerable to infection from injury from external environment because of the constant exposure to particles and infection from organisms in the ambient air. So just remember, albeit everything is COVID-19, there are other diseases. And we've said this many times, you still have to follow up with your chronic diseases. You still have to see your specialists and your general practitioners and your allied practitioners, because you cannot let these things slide. We've got other diseases in the world. We have to look after ourselves so we keep our comorbidities low and keep ourselves safe.
All right, very interesting and very important indeed. This one just came in, perfect timing whilst we're busy recording. It says, good morning. I hope I'm not too late. Well, no, you're exactly spot on time. I don't know if it's been asked before, but what about having granny and grandpa for Sukkot? Obviously, only if it's weather that we can sit outside, in a big sukkah with a family of 4 at one table and granny and grandpa at a separate table, separate plating. Both are elderly and have comorbidities, but what do you think about that? And also, is it safe yet for children to go to each other's houses? And he says, thanks again for a great program, and Shana Tova Metuka to you and Dr. Meyberg as well.
So I think that's a great question coming up with the festival of Sukkot now. Now, people are going to start to entertain, and I think we've got to be very careful. You definitely can entertain, but keep it to one family at a time if possible. You know, you've got to socially distance, and ideally you'd like at least 2 meters away from the people. Keep them in your sukkah on the far end, have different plating, have different foods, one server to serve everybody. You can have the grandparents over as long as they kept away from you, but in the same environment. And when you're not eating, put your mask back on. Make sure you wash your hands all the time. You can do it. It's time now to do it, because if we can't do it now, we're not sure what the future holds for us. So it's a safe option at the moment. You can do it because, as we said, the virus numbers are lower. And as long as you're taking care and protecting each other, then it's something that can be done.
An interesting observation that I've made, and one of our listeners referred to it earlier, is that sometimes with the elderly, they don't seem to really, maybe because of their life experience, maybe they've lived through worse, maybe they've seen so much, but it's actually quite difficult to convince them as just how important this is. And whereas you're saying you're encouraging people, and I think that's brilliant, to have grandparents over, sit at separate tables, engage
outside,
with them in a safe way outside. One of the challenges that I think people will face is exactly that just to have that constant awareness around behavior.
You see, I think one of the biggest problems with this COVID, and we're taking away the medical side and we're taking away the financial side, is the psychological side.
Yeah.
You know, the anxiety, the mental stress that people have gone through, the elderly being alone by themselves, young people who've committed suicide because of COVID depression. It's been dramatic, and it's been one of the biggest downfalls of the COVID, and there's no way around that, unfortunately. But if now we can try and reverse some of these things, now is the time to do it.
Absolutely right. And I think people need to start with getting outside and having a braai, because it is Heritage Day and that's what we're meant to do. And nothing makes us feel better than standing around a braai and drinking some beer, if that's your thing, and enjoying our beautiful, beautiful weather.
100%. Good idea.
And that is the good news, unless you've got other good news for us.
No, I actually do have good news. Of course I've got good news. There has to be good news. Otherwise, what's the point? Okay.
Right.
So some of us got to go back to shul. It was wonderful. It was well run. It was disciplined and safe. Others got to see family members for the first time, celebrating the holy days whilst observing social distancing and maintaining correct hygiene practices. We know the infection dose we are exposed to determines the severity of the illness. So if both parties are wearing masks and are socially distanced, we can defeat this virus quicker. And I'd be remiss if I didn't say that Liverpool acquired Thiago, and in his first appearance, the halftime substitute completed more passes than anyone has done since 2003 in 45 minutes. You'll never walk alone. And to quote, coming together is a beginning. Keeping together is a progress. But working together is success. I wish you all an easy fast, a healthy, blessed new year. Be safe, be logical, and be unselfish.
Dr. Anton Meyberg, thank you as always. I'm Howard Feldman. This has been the Sunday Synthesis podcast on Thursday. It is Heritage Day. Have a great one. Celebrate a little bit of your heritage as well as others. Get out there and try and lift your spirits, lift the spirits of everybody around, because we will indeed get through this. Have a fantastic day. Be safe.